Good morning. Welcome to Village in Motion. Today is Friday, January 11th, 2019, and we have a special guest this morning, an unusual guest. Not that he is unusual particularly, although he is, but we have this morning an ophthalmologist with us, Dr. John Josephson. Good morning.
Good morning.
And John is here this morning because he is going to be visiting later this month, next week, for one of our lunchtime health series sponsored by our fitness center.
I'm happy to be here.
And we're happy to have you here to give us a little teaser about what you'll be talking about next week.
Sure, thank you.
So you are an ophthalmologist here in the Fairfax County area.
Right.
And tell us a little bit about your practice.
Sure. So we have a practice out in the Fair Oaks area. Our practice is dedicated to the medical and surgical issues that can occur in the eye. And we definitely focus a lot on the medical and surgical issues in the maturing eye population. So we deal with everything from the dry eye, the irritation of the eye, all the way through some of the more complicated surgical issues. We're delighted when we can help someone go from challenges in their vision to kind of normal, happy, active lifestyle.
So you are an ophthalmologist. Tell us the difference between an ophthalmologist and an optometrist and an optician. People get confused.
Right, and I can get confused myself sometimes.
Okay.
So the difference really has to do a lot with the training and the focus. You can have, just like in any field, very knowledgeable people on knowledgeable topics, but when it comes down to the degree, an ophthalmologist is someone who has trained in medical and surgical components of the eye, has gone through medical school, has gone through an internship in general medicine or general surgery, and then has gone on to a residency in the surgical components of the eye, and then maybe even doing a fellowship on a small area of the eye, which is something I did. I did a cornea fellowship at UC San Diego. So there may be multiple education levels and surgical. Optometrist would be someone who went to a school of optometry and studied medical components of the eye, as well as a lot of the vision components of the eye, which would be, making sure that someone can use glasses or use contact lenses to optimize the vision, as well as screening for general medical conditions. And then an optician is someone who has been trained to ensure that whatever vision we are prescribing, vision needs are prescribing, that they're adequately prescribed. For example, the glasses are made properly, that the fitting of the contact lens after it's been checked by a doctor is appropriately dispensed. So there's different levels. Again, it's sometimes hard to tease out, but certain problems probably should be directed toward one or the other appropriately.
And you're really kind of a team that works together.
Of course.
All three levels.
Of course, yeah.
Right.
And it's actually a beautiful thing when we can have someone who is screening regularly, knows the appropriate time to make sure that if someone needs surgery, very common cataract surgery, glaucoma surgery, and then of course some of the more complicated issues with cornea and cornea disease, that they're being appropriately managed.
So in our age group here at Green Spring, many of us have challenges with our eyes. What on a day-to-day basis, what's the best thing we can do to take care of our eyes?
So first of all, we always recommend annual exams. So making sure that you're at least having your eyes checked. It's very easy to go on cruise control. And I have had patients...
Sure, I can see. I don't need to go to the
doctor.
Exactly.
I've had patients who've said, I saw a doctor last year, and then when you get the record, you find out it's been 5 or 6 years.
Right.
Didn't even realize that it had been so long. And it's understandable as a human being. Doctors are the worst patients sometimes. But making sure you get that annual screening. Sometimes you'll get a postcard or a phone call saying, hey, it's time for your exam. Taking that seriously, especially when we start to get over the age of 50. Because I look at the eyes, and why I love the eyes, and I think it's a beautiful field, is when I look into someone's eyes, I can see a lot. I don't just see the health of the eye, I can see the health of the body. So getting that annual exam can really, an annual exam meaning a full exam, dilation, making sure we see the back of the eye appropriately. There's a lot of cameras out there and different things that can see parts of the eye, but we really want to make sure that we're seeing everything. So getting that annual exam is very important.
And when you look at the eye, you can see indicators of other diseases sometimes. Am I correct?
Absolutely, absolutely. I've had people who I've looked at and I've said, "Were you a premature baby?" And I look, and then they go, "Oh my gosh, how did you know that?" And you can see that from the eye. Those are more for fun.
Interesting.
It doesn't really change the person's health in any way. But then there's other things you can see: diabetes, high blood pressure. You can see issues with diet and health, and so there's a lot of things that when we look into the eyes, we're looking. This is why as a ophthalmologist who went to medical school, I'm looking for not just the health of the eye. I'm looking for the health of the body.
So that annual checkup is really important.
Absolutely.
How about on a day-to-day basis? We're going in and out of the sunlight. Is it important to wear sunglasses?
Oh, absolutely. The sun, is our, it feels great, obviously, and provides warmth, but also provides, UV light, which can be damaging. Especially if,
UV being ultraviolet light.
Ultraviolet light.
What is ultraviolet light?
So in the spectrum of light, ultraviolet is one of the light spectrum. It's hard to explain the exact physics of it, but the ultraviolet light is a specific, has a specific quality to it that can be damaging to the eyes. There's different types of UV light. At the end of the day, we want to be protecting our eyes from the different sources of UV light.
There's UVA and UVB.
Correct. So UVA, UVB light. There's actually some UV light that can be also from some of these halogen lights and these LED lights. So we want to just try our best to protect. So when we're outside, we want to make sure we have the appropriate sunwear. There are different types of sunwear that are out there. Speaking to your optician when you go to get your eyeglasses. If you don't have any need for eyeglasses, it still makes sense to have a pair of sunglasses, especially if you're driving, all the different reflections that are coming at you. There are amber tint glasses, which may be good. Sometimes people start getting some glare at night driving and different things. So there's different types of glasses that can be worn. And we're going to be discussing this next week when we have our meeting. But we always just want to be sure that we're doing the best we can. If we start to see any changes in our vision, we want to make sure that we are appropriately handling those day in and day out activities, along with asking the counsel of your eye doctor.
If I suspect there's something wrong with my eyes, and I remember a few years ago I had something wrong with my eyes, and I put off about 3 days going to see my eye doctor, and the eye doctor at the time said, "If this ever happens to you again, you must be seen immediately."
Right.
And he was very terse. He put the fear of God into me, I think.
Right.
And I think that's an important thing to let people know, that don't put off something with your eyes.
Absolutely. Our office, I love my staff. I have a wonderful staff in my office, and we have these meetings all the time to discuss what is a true emergency, what is urgent, and what is routine. I never want someone to call my office and say, I'm having this issue, and us say, okay, we'll see you in 3 months, when it's something that's emergent. Obviously, there are things that are more routine, and those things can, don't have to rush into the office. And it's hard sometimes to decipher that by symptoms. But if something is happening that's sudden, to just ignore it probably isn't a good idea, especially when we start to get, our eyes are maturing. Sudden vision changes, flashes of light, spots in the eye, these different things that can happen.
Something you haven't seen before.
Correct. Something that's new and that's kind of sometimes startling. The worst scenario is you get an eye exam and say everything is fine. Again, as we start to get, as we are maturing, you really want to be in the hands of someone who knows the medical and the surgical components of the eye that could be, compromised here. So very important to get checked out. Our office for sure, when we hear these kind of conversations, if there's a question of is this urgent or non-urgent, we always kind of err on the side of caution. And make sure that we take care of the patient first.
So you would recommend call. If you're not sure, call and ask you.
Right. Call. Yeah. I would call before checking Dr. Google, because everyone will go online and type in their symptoms, and there's nothing wrong with that. I think it's good to know what's out there and try to get a sense of urgency. But calling the office usually can help to kind of figure that out. We have email on our, and actually some of these emails come directly to me on our website. But those emails are simply for questions of when can I get an appointment type things.
Sure.
Really calling the office, trying to get in, especially if you have a relationship already with our office, then we know your history.
Sure.
We know if you've already had some issues that we were concerned about, you have this recurrent issue that keeps on coming up. Once that happens, we know that this is something that's serious.
Sure, right. But the bottom line there is don't hesitate to call.
Absolutely.
Right.
Absolutely. No,
if it's something that worries you, and never think, oh, well, I don't want to bother them. They're busy. I hear people say that so often.
It's never a bother.
Right.
I mean, that's why we're here.
Yeah.
We're here to help people. We're here to make sure that people's health, especially eye health, is being taken care of appropriately.
What are the most common problems for people in our age group, and people here at Green Spring are 63 and above? What are the most common problems that start to appear in this age group?
Well, in my office, 63 is a teenager.
Oh, there you go.
So, we deal with this population day in and day out. The most common would probably be, I would probably split up into two different areas. Most common probably being dry eyes, eye irritation. It's just so common, especially in the winter months.
What do you do about dry eyes? What do you recommend?
Do you have enough time?
Sure. we have 12 minutes.
12 minutes, fantastic. So dry eyes, we can start from the simplest. You have your array of drops. If you go to the pharmacy, and it's actually probably causing dry eyes just to look at the array. But there are
because you're staring at so many.
There's so many there. But starting with the drops, all the way to stem cell therapies. So we have therapies where we use stem cells on the eye to resurface the eye. So there's a whole vast spectrum of different things, and we pride ourselves in our office because that's something that we take special interest in. So the dry eye, the irritation, the eyelid, having crusting on the eyelids, we try to take care of all these things because when those things are going well, that component is going well, the rest of the eye feels much better, and the vision improves as well.
I just recently learned, I had cataracts removed. I just recently learned that there's more to what keeps your eye moist than just your tears.
That's correct.
That there are 3 layers there.
Correct. So there's the oil component, there is the water component, and then there's the mucus component. And if any of those 3 layers go awry, you can have the sensation of irritation, foreign body sensation, feel like the eyes are tired and sore. So it's amazing how complex this area of the eye is, and that's why so much effort is being put into trying to figure it out.
So a lot of work is being done in that area.
Absolutely.
And as we're working with computers, and I also sew a lot, I find myself, as we were talking earlier, eyes wide open, staring for long periods of time, and that doesn't help.
Absolutely. There's actually studies to show when people are looking at a computer, they blink less. So this is actually starting to become a syndrome. People are naming it computer vision syndrome.
Interesting.
So they blink less, and when you blink less, that windshield wiper isn't wiping away as much. You're not moving the oil component or the aqueous component around, so the eye's dry. So it's almost like you have to remind yourself, and I tell my patients all the time, if you're sitting somewhere for 60 minutes doing anything, you have to take a 5-minute break because you have to give yourself some time to reboot. So especially with the computers, and I won't go into the whole blue light issue.
Of course not.
But there's some theories about the computer emitting some lights that could be also damaging. So we want to make sure that we're taking care of our eyes. If we're going to sit for a prolonged period of time doing something, we may want to use an artificial tear or something like that just to kind of make sure the eyes are lubricated well.
That's interesting. So that's one common problem you see with our age group.
Correct.
What
And that actually goes even to to some other age groups as well. Another area is cataracts. You mentioned cataracts.
Yes.
Definitely the most common issue that we deal with in our office. So cataracts being a clouding of the lens of the eye. And happens over time. Some people happens at younger ages, and some people as we mature. But cataracts, thankfully, is a reversible condition. So someone has a lens opacity, it's cloudy, they start to maybe have trouble driving at night, maybe a difficult time reading even with their reading glasses, blurry vision overall. Any of those types of symptoms, having their cataracts taken care of, which is a outpatient procedure, 15, 20-minute procedure overall, can restore vision. And there are different lens options and different things, and
lots of different choices.
Lots of different choices. And in our office, I know that I have this conversation 5 to 6 times a day. But the person sitting in front of me has never heard this before.
It's brand new for them.
Right.
Well, I know when my mother had cataracts removed, a lot of what she understood about it was watching her mother, for whom it was an in-hospital procedure,
Right.
lying with her head.
Sandbags are on
Yes,
there.
right.
Yeah.
And so it is so much different today.
Absolutely, absolutely. And we want to make sure that we educate and discuss that.
Yes.
Because medicine is scary, especially to someone who may not have gone through some procedures before. So we want to explain what the experience is going to be like. And we have wonderful, so myself, I have a conversation with the patient as well as my staff to make sure that everyone is on board to know what they should experience so that their expectations are met.
Good. And ask lots of questions.
Absolutely.
And the important person to ask is the doctor's office, not Dr. Google, and not your neighbors.
So I welcome people to ask Dr. Google or to check online because we want people to be educated on some things and make sure we educate on what they read may not be correct. So sometimes that comes up.
That's a very good point, because sometimes you can see something on the computer and you can say, oh, maybe I should ask about that. What if that happens to me?
Right. Well, I was counseling a patient once, and they brought up some topic, and I was like, this doesn't sound right. I asked them to bring it in. I found out that they were actually looking at a procedure done back in the 80s.
Oh, interesting.
And they thought that that's what I was trying to do for them.
Ah.
So sometimes, again, with acronyms and different things that, people
Right.
bring up, can be miseducated or misinformed. So we have a job as doctors to make sure that we are, kind of taking away the misbeliefs
Right.
and making sure that people are getting the right information.
You mentioned the word acronym there, and it reminded me of a term I want to ask you about, a term that we see often that's relatively new, and that's the term LASIK. What does that term mean? L-A-S-I-K.
So LASIK is. I would have to. I don't want to misspeak.
Mm-hmm.
I have a lot of words in my head that I want to make sure I'm putting together
Okay.
correctly. LASIK is a refractive procedure, which we basically create a plane in the cornea, and basically with laser remold the cornea into a certain shape. So it's laser assisted, say, to keratectomy. But I don't want to throw
big words around.
Those are big
now.
words, and I don't want to put them all together correctly. But the procedure is to remold the cornea so that people can get their vision correction similar to what they would see in a contact lens, but then they don't have to wear the contact lens. There are risks, there are benefits. Some people are good candidates, some people are not. Even in the maturing population, there are reasons to consider refractive surgery, but that has to go with good counsel. So I have done LASIK procedure on someone who's 93 years old. But there was a reason, and there was a conversation that went into why we're doing this. And when we have those conversations and make sure that everyone is on board with what we're doing, results can be excellent.
Interesting. I know my eye doctor said to me once, just out of the blue, he said, and by the way, if you ever think about it, you're not a good candidate for that. And I'd never thought about it, but it was interesting that he counseled me at that point.
And some people will sometimes, be considering cataract surgery or a different procedure, and then all of a sudden get information about LASIK and think that that's what they're having done.
Yeah.
So these, my son had the procedure done, and it took 1 minute, and
Wow.
and then you realize, wait a second, we're talking about two different things.
Yeah.
So.
What about glaucoma?
So glaucoma is a really, it's probably the most challenging condition in our field. And the reason is not so much how we treat, the problem is that people come in often too late. This is a part of why we need annual screenings. Glaucoma is a condition of the optic nerve, where over time, the optic nerve becoming damaged, we can start to lose peripheral vision, so our side vision, and slowly over time lose our central vision. There are no symptoms for a lot of glaucoma patients until the end stages. So you may go to the eye doctor and they may find something concerning, and you are walking around with perfectly good vision.
So every time you go to the eye doctor, whether optometrist or ophthalmologist, are they going to check for glaucoma?
So what I would say is this: glaucoma is not just eye pressure. So sometimes you can go to a screening facility and they'll just puff of air in the eye, and you think you've gotten a glaucoma check.
Oh, and that's what I always thought. That's not the case.
That is not the case. So eye pressure can be normal, and you can still develop glaucoma.
Okay.
So, which is why it's important to, I would ask the person, so if you're going to an eye doctor's office, have you screened me for glaucoma? If you're uncomfortable or unsure or have a family history, I would recommend seeing an ophthalmologist just to make sure that there's nothing else there, especially if you have risk factors.
That's good to know. And macular degeneration is another word that we hear a lot around here. What is macular degeneration?
Macular degeneration is a condition of the retina. The macula is 95% of our vision. So when we're looking out at anything, the center of our vision is where the macula is what the macula is providing. Over time, different waste products cannot be absorbed appropriately, and you may get some spots on the back of the eye that can cause the vision to be distorted. And this is something that can slowly progress over time or can happen suddenly. So we often advise people, if they have vision changes, to make sure that they get checked for all these different issues with the eye. There are different forms of macular degeneration. If we see any of those forms, a lot of times we'll recommend vitamins that can, in studies that were done, slow down the progression of macular degeneration. And then there are forms of macular degeneration where we got to get in right away, and there's actually treatments with injections that are done to try to slow down or try to mend the process.
Interesting. I think a lot more, as I understand it, more can be done today with macular degeneration than 20 years ago.
Absolutely. It's a beautiful thing that we actually have a treatment for one of the forms of macular degeneration, which the name is the wet form of macular degeneration.
I've heard of that.
So when someone has wet macular degeneration, having a treatment, it's not a cure, unfortunately, a lot of things, but if we have a treatment, at least we can try our best to maintain vision. And having that opportunity is wonderful.
It's good. So talk to me about the importance of, if I'm prescribed glasses, of wearing my glasses. Is it important for me to wear them all the time?
So it depends on what they're prescribed for.
Okay.
So if someone is prescribed glasses for distance and for reading, it probably makes sense to wear them. Now, if the prescription is mild, it may not be as important to wear them all the time. We did mention UV light protection. So it depends also on if those glasses are what you wear for sunlight exposure, and these are your kind of outdoor glasses, we'd recommend you wear them. There are other situations. There are situations where people have, one eye doesn't see well, the other eye does. We want to protect that good eye. You probably want to keep your glasses on. There's all types of things in the environment that can get into our eyes. We want to protect from that.
Oh, and that's a good point also.
Right. So it's important to make sure that we are protecting our eyes. If they're prescribed, it's a good question to ask the doctor. Is this something that's part-time wear or full-time wear?
Very important. And one of the people here in the studio mentioned that sometimes glasses have UV protection built into them.
That is correct.
So you may not necessarily need sunglasses when you're outside because that UV protection is built into your glasses.
Absolutely. And that would be something to ask the optician who dispensed the glasses to make sure that that information is correct. Because if your glasses do not have UV protection, you may have to wear a UV protection glasses over them.
Interesting. So you're coming back to see us right here in person in the Village Square Classroom.
Right.
And we're putting up a slide right now, the Village Square Classroom at 1 o'clock on Thursday, January 17th. And we invite everyone to come.
Great.
And they can ask you lots of questions in person.
Look forward to it.
I just asked my questions. I've had that opportunity, but I'm sure others have lots of questions. So we invite people to join us that day and to meet you in person.
I look forward to
and
it.
bring their questions, and I'm sure you'll have lots more information.
It's my
to share.
funnest. These are my funnest events because
you
see all types of people out in so many different backgrounds, and we love to meet them.
Well, thank you for being willing to share your knowledge, because for those of us regular people, it's like a doctor. He's going to come and talk to us and share his time and knowledge, and that's
just a regular person too.
That's really wonderfully appreciated.